The issues affecting you. Revealed, explained, discussed. Now on WGAL 8 in Focus.
Hello, I'm Susan Shapiro. Doctors and other health professionals always encourage women to prioritize their physical, mental, and emotional well-being. Over the course of a lifetime, a woman will have different health concerns. Tonight, we're speaking with the Pennsylvania Secretary of Health about women's maternal health and an OBGYN physician about women's health as they age. We're putting women's health from childbearing to menopause in focus. Joining us now is Acting Secretary of Health in Pennsylvania, Dr. Deborah Bogan. Thank you so much for being here.
Thank you for having me.
This is certainly an important topic for women and for families of maternal health.
It is a very important topic, and it's a priority for the administration at large, as well as myself and the Department of Health.
The March of Dimes in 2023 gave Pennsylvania a C+ for its preterm birth rate at 9.6%. Is that acceptable, or how do we improve that?
No, we really need to do some work and to make sure we bring that down. It is, pregnancy health is really an indicator of how we provide care in our country. And so it is an important metric that we all follow to make sure we're doing better. And again, it's one of the areas that we need to make improvements on.
What are some of the causes of preterm birth?
It's a complicated topic. We don't really entirely know what all causes preterm birth, but we know that getting good prenatal care, having a healthy diet, taking care of medical problems before you get pregnant is helpful to reduce those things like diabetes and high blood pressure, but we don't really have an answer to exactly what causes preterm birth.
How important is prenatal care?
Prenatal care is really important. It helps people understand when they are pregnant what is normally supposed to happen in a normal, healthy pregnancy. What are signs of potential problems so you can get help early. And it also identifies things that can be treated. So without prenatal care, things can get out of hand and things we could treat early on. So for instance, it identifies things like gestational diabetes or high blood pressure or things that we can treat that will help make the outcome of the pregnancy better. So we really think prenatal care is important. It also prepares people to know what's coming, right? So that's what preventative care is. And in pregnancy, preventative care is really that prenatal visits to make sure you're healthy and ready to deliver the baby.
What about access to care? In Pennsylvania, certain hospitals have closed their OBGYN reproductive services. How concerning is that to you?
Well, we know that access to care for your health in general is important, but unequal in that there are some people who have much better access to care than others. And so that concerns us, right? We want to make sure that everyone has access to care. In rural parts of the state, again, with hospital closures, that can certainly impact access to care. And ideally, people would be within, a short distance to get the care that they need. And there are people who are traveling much farther than others to reach that care. But we also have differences in health insurance and access to health insurance and other barriers. Also, paid time off to be able to get to care, whether we have access evenings, weekends. So there's a lot of issues around access to care that we need to think about. But we sure know that people who don't have access to care have worse health outcomes, and they're more likely to wait until their illness or issue has become more serious than people who can get earlier access to care. So it is an important part of health outcomes.
I think I read the average care is about 10 miles away for women, but obviously that's different in some rural areas of Pennsylvania, which is in the middle part of the state, very rural.
Exactly. We have a very, we have some urban centers, but we have a lot of rural space between. And in some parts of our state, the hospitals are farther apart than others.
I mentioned the preterm birth rate. For Black birthing people, it is 1.5 times higher than for other people. Why is that, and how do we change that?
Yeah, we have differences in racial outcomes for preterm birth, for infant mortality, and for maternal mortality as well. And it's many factors that contribute to those, but we know that one is for sure access to care. I think another important one we think a lot about is communication and trust in the system, and making sure that you have established healthcare relationships that you trust. As a pediatrician, I cared for families over time. And I learned about them and they learned about me, and we learned each other's styles so we could communicate effectively and learn from each other and be supportive. And so I think it's really important that people have a trusted healthcare provider that they can go to when they have issues. And we have a bit, I think, in some ways lost that, that, you know, when you ask people, do you have a doctor you trust and you know, or a healthcare provider you know and trust, that isn't true for everybody. And there are definitely differences in racial disparities in that relationship. And so, again, how do we rebuild those systems to make sure that people identify with a healthcare provider who they know and trust around communication, I think, is one area, but there's many factors, not just one.
Yeah, it's easier said than done. Well, stay with us. We'll talk more about that and about the WIC program in Pennsylvania.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation about maternal health and infant health with the Acting Secretary of Health in Pennsylvania, Dr. Deborah Bogan. Again, thanks for being here. Pennsylvania's infant mortality rate is 5.37 per 1,000 births. While that's not the highest in the country, I guess that's still high for a country like the United States.
Yeah, I mean, infant mortality, as a pediatrician, you know, that really speaks to me and of course concerns me. And there's a lot of work to be done, but we are making some strides in really trying to address those issues through a variety of programs across the Commonwealth. I'm going to bring up the WIC program because I know the WIC program really well, and we do oversee the WIC program at the Department of Health. And WIC, which is celebrating 50 years this year, is really a program that has been demonstrated to have great effects for both pregnancy outcomes and child outcomes. And again, people who participate in the WIC program have better health outcomes, including lower rates of preterm birth and infant mortality. So really want to promote the importance of that program to people who might be watching today.
Yeah, people who may not know about it or think they might not be eligible, women, infants, and children. Tell us a little bit more about what that does.
Sure. So the WIC program, Women, Infants, and Children's program, is really a nutrition, both education and support program for pregnant people, for infants, and to children up to their 5th birthday. And it provides both nutrition education as well as food packages that are age appropriate. They also link people to services and care that they need. They monitor the health of the growth of the child, as well as looking for anemia. So they really are a comprehensive program that links people to services as well. So again, across our Commonwealth and across the country, every study that's looked at WIC has shown that it's beneficial at keeping people healthy and well, both in pregnancy and after delivery. We've been making a lot of strides. So one of the interesting things is, you know, we know that about 50% of infants born in Pennsylvania are eligible for the WIC program, but only about half of them sign up. And so we want to make sure we are lowering barriers and getting people into the program. And we're doing that in lots of ways. One way is really increasing the number of vans mobile units that we have out in the state. We currently have 5 out on the road already, 5 more in the works to try to reach people where they are. That's one. Reducing access through increasing the number of grocery stores that take the WIC program, allowing teleservices as well. So we're really trying to reduce barriers to get people into what we know is a really effective program to help them and their children.
Why aren't people signing up who may be eligible? Is there a stigma about it?
I don't know if there's so much of a stigma as there are barriers or lack of knowledge. But again, that's why we really want to promote the program. 50 years, this program has endured for 50 years. We want to see it going into the future for another 50 years to really support families.
Through many administrations, it has come through. Back to pregnancy. I know there's been a lot of talk about doulas and funding for doulas.
Yes.
Explain what that is and what you'd like to see.
Sure. Doulas are, I like to think of them as the go-between between the patient and the healthcare provider. They are trained paraprofessionals who work within the healthcare system, but they meet people both during pregnancy, they help people during labor and delivery, and then they help people postpartum. And they do lots of things, from sort of wiping someone's brow during pregnancy or during delivery and coaching them, to making sure that if they're experiencing pain or something that is heard by the healthcare team. So,
And they're not physicians.
They are
or
not
medically
physicians. They
trained.
are lay trained, sort of, I call them advocates for patients, but they really do serve that communications gap that sometimes happens in healthcare. Again, you're a woman in labor and in pain. You have a doctor or healthcare provider who's trying to do a delivery, and there can be chaos. They really make sure that people talk to each other and making sure that both sides are heard. But they also they know about pregnancy, they know about labor and delivery, and they help translate that for the patient. Sometimes, I'm a doctor, sometimes we use language that may be challenging, but we try really hard not to. But again, making sure that patients really understand what's happening. They help. We know that people who get doula support in their pregnancy, labor, and delivery, they're more likely to breastfeed. They have lower rates of preterm birth. They have lower rates of C-section. They really have better outcomes as well. And I think it's because they serve that interpretation role, because they understand both sides of the situation.
Is it something covered by insurance?
So more and more it is covered through our Medicaid insurance, the details of which I can get back to you on. But right now Medicaid has approved, if you're a certified doula in Pennsylvania, they're working on making sure that if you're a certified doula through the Medicaid program, that you can bill for those services. So that is a really wonderful thing. So for all those doulas out there, please get certified. If you want to become a doula, there's all kinds of doula training programs in the state as well. It really is an amazing career, and you really do help families thrive and have better outcomes.
Oh, and that's what you've been doing, helping families thrive. Thank you so much for being here. We appreciate your time.
My pleasure. Thank you so much for having me.
This is WGAL 8 in Focus. Coverage you can count on.
I'm in menopause! Okay? And that's why I'm having this issue!
That was Halle Berry speaking in May. She joined lawmakers pushing for funding for education and research around menopause as we continue our discussion looking at that season of life. Joining us now is Dr. Dorothy May, an obstetrician and gynecologist with Eichenlaub and May. Thank you so much for being here.
Thank you for having me.
As we heard, the word menopause and the subject has become much more open among a lot of people, including an actress.
Yes. I think that the topic of menopause is definitely the hot topic of today. You can't read an article or watch the television without someone talking about the topic. And I think
that's a good thing, isn't it?
That's an excellent thing. That's a really good thing for women. Unfortunately, maybe it was because it wasn't a topic we talked about very much. But I think right now there is a generation of women who are looking for information, counseling, and what they can expect and what they can do to help their symptoms.
I was telling you earlier, there's so much information when you begin menstruation, but then at the other end, there doesn't seem as much, but maybe we're changing that. How do we define menopause?
Sure. So menopause actually is defined clinically in terms of when a woman just stops having her period. So the clinical definition is no menstrual period for 1 year. Many women will experience changes in their menstrual cycle for several years leading up to menopause, but once you've not had your period for 1 year, then we will say you are in menopause at that time.
Those prior years, do we call that perimenopause?
Correct. Yes.
So the symptoms seem to be all over the board for a lot of different women. What are the most common that you see?
Sure. So every woman does have very, very unique symptoms. Not everybody has to have all of the symptoms. The most common symptoms are what we call vasomotor symptoms, which is a hot flash or a night sweat. Most women will describe it as they have a central warmth, a feeling of heat, followed by a little bit of a chill, and that can last anywhere from 30 seconds to a couple minutes. So those are probably the most common symptoms. The vasomotor symptoms, the hot flashes happen during the day. When they happen at night, they're called a night sweat and can often interrupt or disrupt women's sleep. So sleep disorders can be also very prominent in menopause. I would say the objective symptoms, the hot flashes and night sweats, are ones you can quantitate. And then there's some more subjective symptoms. We'll see women have changes in their mood, more irritability, maybe some more cognitive changes, kind of a fuzziness as well. So there's kind of the ones you can count, and then the more subjective symptoms.
I must say, I don't feel like I had a lot of those symptoms.
Sure.
You know, I've asked a hot flash, and people have said you'll know it if you have that, right?
Most people do, and I would say not everybody. Some women will cruise through menopause without many symptoms at all. They'll, you know, so you count yourself lucky when you are the woman who doesn't have many symptoms, but then some can have significant changes in their quality of life, that it really disrupts their daily living.
And what kind of impact can it have on your health?
Well, I think a lot in terms of if it's impacting your sleep. The actual, as they say, hot flashes and night sweats, a lot of women don't get a good night's sleep. That follows into the next day where they're kind of sleep deprived and tired. And that can impact how you exercise, how you're eating, your other normal parameters of healthy living. I think that can affect multiple areas.
But what about the reduction of hormones? Can that affect you in different ways?
It can. There's many other secondary symptoms. Most menopause symptoms are an estrogen deficiency or an estrogen dropping. So it can affect your bones. A lot of women will lose some bone loss during the time of transition through menopause. I think there's also some significant changes to sexual function, the external genitalia and dryness in the vaginal area, and relationships in terms of sexual intercourse.
What do you find with your patients? Do they have a hard time talking about this, or do you want them to approach you and ask you, questions?
I think there is a general lack of information, and I think for a lot of women, they're looking for counseling and education. They're looking for what is normal, what am I going through? Because a lot of women will feel like they're alone and they don't know if what they're experiencing is normal. They talk to their friends. So I think for a lot of women, they're coming to be heard and to be said, yes, you're experiencing this, and this is what is normal. This is what you should be expecting as you're making this transition. So education and counseling so that people can make informed decisions is, I think, a big part of that transition.
Absolutely. Well, Dr. May, stay with us. We'll talk more about the treatment for menopause.
This is WGAL 8 in Focus, coverage you can count on.
We continue our conversation with Dr. Dorothy May, an obstetrician and gynecologist with Eichen Laubman May, and we're talking about menopause. Has the treatment changed over the years?
So I wouldn't say necessarily the treatment has changed. I think our approach towards the treatment has altered. I can give some perspective because I've been doing this for quite some time. And I would say historically, there was a time if a female went into a doctor's office, a gynecologic doctor's office 30 years ago, everybody was placed on hormones at that time, regardless of whether you had a symptom or not, with the belief that you were missing something and so you should be on hormones, and they were on them forever. There was a very large study done by the NIH in the late 1990s, early 2000s that looked at the risks and benefits of hormone replacement therapy, hormones for women. And it was a pretty dramatic study because it stopped, and I remember July of 2002, it got leaked to the press, and the news people knew about it before we did as physicians, that showed hormone replacement therapy caused breast cancer, had an increased risk for breast cancer for people who'd been on for more than 5 years. At that time, everybody went off any type of treatment modality, and I think from the pendulum swung the whole way to the other side. Now we're seeing it come back a little bit because at that time, I think the study scared people about treatment options.
Yeah. So what's the protocol now?
So the protocol now is really to talk to patients, individualized therapies, find out what your symptoms, educate them about what is normal and what is not considered normal, and then find out how much their symptoms are impacting their quality of life. Basic healthy living, diet, exercise, what any doctor is going to talk to you about. And then finding out if they're looking for treatment options. Probably the standard is still hormone replacement therapy for patients who are finding that their symptoms are really impacting their quality of life.
But for a limited time?
So typically, yes. I mean, I think there is a targeted amount of time within the first 10 years of transitioning through menopause. Most of us by age 59 or 60, people are coming off. We typically do hormone replacement therapy for up to 5 years, although I think in talking to patients, it is how are you doing? What do you think? Where are you in your life? What are your risk factors? But the slight increased risk of the breast cancer goes in for after 5 years.
And some people might not need it at all, correct?
Absolutely, absolutely. Some patients, and that's where it comes into finding out where you are and how it's impacting your life, along with your other, risk factors, medical conditions. Yeah.
Now, what we showed, Halle Berry was there with some legislators calling on the federal government to do more funding for research. Right. Do you think that's a good call?
I think it's a great call. I think, as I alluded to, you cannot go anywhere without women specifically asking or wanting more information about what this is, what they're going to go through. And as I talk about hormones, but there's other options that women can have that just don't look at there are non-hormonal options that people can look for treatment therapy. But there are options, and education, learning about yourself and how you think it's going to be the best way to go through this. But I think more attention to this. It is a phase of life, and it's a phase of life that probably hasn't gotten the attention that it really deserves.
And also the men in their lives should be educated as well.
Absolutely. Yes, absolutely. Yes,
yeah.
yes.
Nothing to be ashamed about and to talk about, is
Yeah,
it?
I think, and that's part of what it is I think for a long time there was a negative connotation about it because it kind of went, I think people thought it was related to aging. And I don't think that needs to be. I think it can be a positive time in your life as long as you know what you're dealing with and how to deal with it.
Yeah, there's no avoiding it, right? It's
Correct.
going to happen to everyone if you live long enough,
Yes,
right?
yes, yes.
So that's a good thing.
Yes.
Dr. May, thank you so much.
Thank
We
you.
appreciate your knowledge.
Thank you very much.
Thank you for joining us for WGAL 8 in Focus. For all of us at WGAL, I'm Susan Shapiro. And join us again next Saturday night at 7 o'clock for WGAL 8 in Focus right after NBC Nightly News. And you can watch each episode of In Focus plus WGAL's latest newscasts, original programming, and more. Just download the Very Local app and stream for free on Roku and Amazon Fire TV.